If you're over 60, there's a good chance you've been bathing the same way for decades. Same temperature, same soap, same routine. But here's the question most people never stop to ask. Does the routine that worked perfectly at 30 still make sense for your skin, balance, blood pressure, and mobility at 65 or 75? The answer may surprise you. And no, this doesn't mean you should stop bathing or suddenly become afraid of your shower. That's not the point. The bigger issue is that aging changes the way your body responds to heat, water, cleansing products, and standing on a wet surface. A habit can be perfectly normal and still need a small adjustment as your body changes. Imagine a 71-year-old man named David. He lives alone, still drives, shops for himself, and takes pride in being independent. Every morning he takes a long, very hot shower. Recently, however, he noticed that getting out of the shower left him unusually tired. One morning he stood up too quickly, felt lightheaded, and had to grab the wall. Nothing dramatic happened that morning, but that small moment changed how he thought about his routine. He realized that the problem wasn't necessarily bathing itself. It was the combination of heat, standing, rushing, slippery surfaces, and the way his body responded. And that is exactly why bathing after 60 deserves a little more attention than most people give it. When professionals look at bathing in older adults, they don't focus on one magic number of showers per week. Your ideal routine depends on your skin, activity, sweating, climate, medical conditions, medications, and personal preference. The goal is much simpler. Stay clean without unnecessarily irritating your skin or creating avoidable safety problems. Here's what changes with age. Skin generally becomes thinner, drier, and less efficient at retaining moisture. Natural oil production can decline. At the same time, many older adults become more sensitive to heat and may have medications that influence blood pressure or fluid balance. So the same 10-minute shower can create a very different experience at 70 than it did at 30. Think about your skin as a protective wall. It isn't supposed to be completely stripped and squeaky clean. Its outer layer helps hold moisture inside and protects the body from irritation and unwanted microbes. When very hot water, aggressive scrubbing, and harsh cleansers are used repeatedly, that protective barrier can become more vulnerable, especially when the skin is already dry. But let's correct one dangerous misconception before going further. There is no universal rule saying every person over 60 should shower only 2 or 3 times a week. Someone who exercises daily, sweats heavily, works outdoors, or has particular hygiene needs may need more frequent bathing. Someone with very dry or fragile skin may prefer less frequent full-body washing. Your routine should fit your body, not somebody else's calendar. The first mistake is turning the shower into a sauna. Very hot water can feel wonderful, especially when your joints feel stiff in the morning. But prolonged heat can increase skin dryness and cause blood vessels to widen. For some older adults, especially those taking blood pressure medicines, this may contribute to lightheadedness when standing. The safer approach is surprisingly simple. Choose comfortably warm or lukewarm water instead of extremely hot water. You don't need to freeze yourself either. If your skin becomes tight, itchy, red, or uncomfortable after bathing, that's useful feedback. Your shower should leave you feeling refreshed, not as though your skin has been baked. Here's a simple example. Suppose you normally spend 15 minutes under very hot water because it helps your back feel better. Try reducing the temperature and shortening the shower while using gentle movement afterward to loosen up. If you regularly feel dizzy, weak, or faint during or after bathing, don't simply push through it. That's something worth discussing with your healthcare professional. The second mistake is aggressive cleansing. Many people automatically cover their entire body with strong soap every single day and scrub until the skin feels completely stripped. But clean doesn't have to mean squeaky. Especially after 60, repeatedly removing natural oils can leave the skin dry, tight, itchy, and more easily irritated. Instead, think about targeted cleansing. Areas that commonly collect sweat, oil, or odor, such as the underarms, groin, feet, and skin folds, deserve careful attention. Other areas may simply need gentle washing rather than vigorous scrubbing every single day. A mild, fragrance-free cleanser can be a better choice for sensitive skin than a heavily perfumed product. And here's the hidden clue. If you finish your shower and your skin immediately feels tight or itchy, don't automatically reach for more soap. Consider whether you're using too much cleanser, water that's too hot, or spending too long in the shower. Sometimes the solution to dry skin isn't another product. It's removing the thing that's irritating the skin in the first place. The third mistake has nothing to do with cleanliness. It's assuming the bathroom is automatically a safe place. A wet floor, a raised shower threshold, poor lighting, and nothing stable to hold can turn an ordinary shower into a balance challenge. And after 60, protecting balance becomes increasingly important because one fall can have consequences far beyond a bruise. So look at your bathroom like a safety inspector. Is there a secure grab bar? Is the floor slippery? Can you easily step into the shower without lifting your leg too high? Is there enough light? Would a shower chair make bathing easier? These aren't signs that you're weak. They're examples of designing your environment around your current abilities. Here's an important distinction. Don't confuse a towel rack with a grab bar. A towel rack may look sturdy but isn't necessarily designed to support your body weight. If you need assistance while standing, professionally installed safety equipment is a much better option. And if you've already experienced dizziness or instability in the bathroom, tell your doctor rather than quietly adapting around it. The fourth mistake happens after the shower. You turn off the water, step out, dry yourself, and immediately start moving around. But if you've been standing in warm water for several minutes, your circulation may need a moment to adjust. Getting up or moving too quickly can be especially uncomfortable for people who already experience changes in blood pressure. Try a slower transition. Before stepping out, make sure your towel and clothing are within easy reach. Hold a stable support if needed. Stand up gradually and give yourself a moment before walking away. If you repeatedly feel faint or unusually dizzy after bathing, that's not something to simply label as getting older. It deserves medical attention. And here's another small improvement. Don't make your bathroom a race against the clock. Give yourself enough time to bathe, dry, dress, and move safely. Independence isn't about doing everything as quickly as possible. True independence means being able to complete ordinary tasks without unnecessarily increasing your risk of injury. The fifth mistake is walking away from the shower with completely dry skin and doing nothing about it. Aging skin often benefits from regular moisturization, especially when it becomes dry or itchy. A simple fragrance-free moisturizer applied shortly after bathing can help support the skin's moisture barrier. You don't need a bathroom cabinet filled with expensive creams. Look for a simple moisturizer that your skin tolerates well. Apply it while the skin is still slightly damp rather than waiting until it becomes completely dry. And if a product causes burning, persistent redness, or irritation, stop using it and ask a healthcare professional or pharmacist about alternatives. This is particularly important if you notice cracking around the hands, ankles, shins, elbows, or other dry areas. Small cracks can become painful and irritating. If you develop persistent itching, sores, unexplained rashes, swelling, or wounds that don't heal normally, don't assume it's simply dry skin. Those symptoms deserve proper evaluation. Now we come to the question everyone wants answered. How often should you actually bathe after 60? There isn't one correct number for everyone. Instead, think in terms of your activity and your skin. If you've exercised, sweated heavily, gotten dirty, or have a medical reason requiring more frequent cleansing, your needs may be different. On the other hand, if you're mostly indoors, don't sweat much, and your skin becomes extremely dry with daily full body washing, you may not need an intense full body shower every day. Some people can maintain good hygiene with targeted daily washing plus less frequent full body bathing. The important point is that frequency should serve hygiene, not become a competition. Imagine two 70-year-olds. One walks outdoors every morning in hot weather and gets sweaty. The other spends most of the day indoors and has extremely dry skin. Telling both people they must follow exactly the same bathing schedule makes little sense. Their bodies, environments, and routines are different. Good hygiene is personalized. Now I'm curious about you. What happens to your skin after you shower? Does it feel soft and comfortable? Or does it become tight, itchy, flaky, or irritated? And do you prefer a hot shower, a warm shower, or something closer to lukewarm? Tell me in the comments. Your answer may also help someone else recognize a problem they've been ignoring. Starting tomorrow, try this simple checklist. Keep your shower comfortably warm instead of extremely hot. Keep it reasonably short. Use a gentle cleanser rather than aggressively scrubbing your entire body. Put a non-slip surface where appropriate. Keep your towel within reach. And moisturize afterward if your skin tends to become dry. Then ask yourself 4 questions. Do I ever feel dizzy while bathing? Do I regularly feel exhausted afterward? Is my skin becoming increasingly dry or itchy? And can I enter and exit my shower without struggling? If you answer yes to any of these, don't panic. Simply bring the issue up with your doctor, pharmacist, physical therapist, or another qualified professional who understands your health situation. Here's the encouraging part. You don't need to completely redesign your life to make bathing safer. Sometimes changing one thing, lowering the water temperature, installing a grab bar, shortening the shower, switching cleansers, or moisturizing afterward, can make the entire experience more comfortable. Healthy aging is often built from small adjustments that respect the body you have today. Consider a woman named Linda, 69, who had started avoiding showers because she felt unsteady stepping over the tub. She thought needing a shower chair meant she was becoming dependent. Her family helped install a proper grab bar and a safer setup. A few weeks later, Linda said something important. The equipment hadn't taken away her independence. It had helped her keep it. That's a mindset worth remembering. Safety equipment isn't an admission that you're failing. It's the same reason people wear seat belts. You don't install a grab bar because you expect to fall. You install one because you value staying safely on your feet. The goal isn't to make you dependent on other people. The goal is to help you remain capable of caring for yourself. Remember this, after 60, healthy routines shouldn't be judged by how hard they are on your body. They're judged by how well they help you live your life. A shower should leave you clean, comfortable, and confident. Not dizzy, exhausted, or covered in irritated skin. Sometimes aging well means learning that gentler can actually be smarter. So let's make this simple. After 60, don't automatically assume hotter is better. Don't aggressively scrub your entire body every day. Don't ignore bathroom safety. Don't rush immediately after bathing if you feel lightheaded. Don't forget moisturizer when your skin needs it. And don't obsess over one universal number of showers per week. Your ideal routine depends on your body, your environment, and your health. The real goal is not to bathe less or bathe more. It's to bathe smarter. Keep your skin barrier comfortable. Keep your bathroom safe. Clean the areas that need attention. Adapt your routine to your activity level. And if a new symptom appears, persistent itching, dizziness, weakness, skin changes, or repeated instability, don't just accept it as a normal part of aging. Now I want you to do something simple. Look at your shower routine and choose one thing you could improve this week. Maybe it's lowering the temperature. Maybe it's getting a non-slip mat. Maybe it's changing your cleanser. Maybe it's finally installing a proper grab bar. Tell me your one change in the comments. And if you know someone over 60 who could benefit from this information, share this video with them. Getting older doesn't mean ordinary activities have to become dangerous or uncomfortable. It means we sometimes need to perform those activities differently. You should be able to shower, get dressed, walk into your kitchen, go outside, visit your family, and continue enjoying your daily life with confidence. The goal isn't to fight aging. It's to adapt intelligently to it. So tomorrow morning, before you turn on the water, pause for just 5 seconds. Ask yourself, is the temperature comfortable? Is the floor safe? Do I have everything within reach? And when you're finished, will I give my body enough time to transition? Those tiny questions can turn an ordinary shower into a safer, smarter part of your morning. This video is for general educational purposes and isn't a substitute for personalized medical advice, diagnosis, or treatment. Your bathing needs can be different if you have heart disease, blood pressure problems, diabetes, kidney disease, mobility limitations, skin conditions, recent surgery, or medications that affect blood pressure or balance. If you experience repeated dizziness, fainting, chest pain, unusual shortness of breath, or a significant change in your health, seek appropriate medical care. And remember, there is no prize for taking the hottest shower, staying in the bathroom the longest, or following someone else's bathing schedule perfectly. Cleanliness is important, but so are your skin, your balance, your comfort, and your independence. Make your routine work for the body you have today, because aging well isn't about doing everything exactly as you did years ago. It's about knowing when a small change can make a big difference.